Welcome everybody to our webinar this evening. I can see we already have quorum, so we will be starting right on time this evening. This is a part of a webinar series that is going to go on over the next 3 months. And this is a webinar series conducted by the Kenya Medical Association with support from its committee, the Physician Wellbeing. It is part of the Equity Group Foundation project that we are carrying out under Kenya Medical Association, together with all other associations for the healthcare workers, the nurses, the clinical officers, the psychologists as well. So we're looking forward to having a really good introductory series, as well as something that is very interactive that touches into our practice, as well as our mental health as healthcare workers in general in this country. So this evening, this is one of the webinar series we are going to talk about. A very important topic on burnout. This is end of the year, so a very relevant topic. It's also the post-pandemic period, very relevant based on what we've been dealing with over the last couple of 12 months. So this evening, I will introduce our speaker for the session, who is Dr. Edith Koba. She's a psychiatrist. She's also a member of the Kenya Psychiatric Association, as well as the Physician Wellbeing. She'll get us started with the presentation, and she'll also speak more about this. Karibu, Daktari.
Thank you very much, Melanie, and welcome everyone. I'm very excited to be here this evening. I hope you can all hear me, and I hope my slides are also visible. Melanie, is that okay?
Yes, we can hear you and we can see your slides very well.
Thank you. So I want to welcome all of us to this meeting this evening. Like Melanie has said, this is us helping us to continue remaining well. And I know most of you who joined our meetings, especially at the height of COVID-19, we remember that we discussed several topics, including burnout maybe. But one of the things that we need to keep reminding ourselves is that because we are human, the same way we keep telling people, ensure you are taking your sugar, you are exercising, ensure you are doing all those things, including doing tests, is the same thing in mental health. So in case a few things I'll say it again, it's the same thing. It's the same way you are told all the time, every October, ensure that you're checking your breast, or all those things that we talk about yearly. And I'm excited to be here this evening because it's about us. And I will keep reminding us that why we are privileged to be here today is because many times we discuss pathology, the thing of those people who get sick out there. And unfortunately, we hardly discuss what is ailing us. And I'm glad that we are here these meetings to discuss us, to make sure that as we continue sharing information about health, as we continue sharing information about how people should take care of themselves, we ourselves have health and we are well enough to share. And I want to believe that all of us have experienced at some point a visit to the healthcare provider. And if you are not well treated, if the person is not smiling, the person is shouting, the person is irritable, I'm sure you will report to us that it was not a very good experience. And that is also true of the people we interact with. And one of the reasons why this happens is because we have been working so hard, we are tired, we are fatigued, and we are no longer able to support other people. So the topic of today, I find it very relevant. And by the way, how did we decide it's burnout to start us off this season? We asked people, what are the areas of interest? What are the topics they want to discuss? And we want to thank you that you mentioned that we start with burnout. And it's a continuous conversation. So if everything is not covered in the next 60 minutes, we hope to keep discussing. So I want to start with this quote. And when I was reading around burnout, I came across it and I thought, wow, this is very nice. That never overestimate the strength of the torchbearer's arm, for even the strongest arms grow weary. And this is the truth even of us. We have been taught to be strong. We have gone through school. We have the skills. We have done undergraduate, some of us until PhD level, but still that doesn't stop the probability that we can break because of the challenges that come with caring. And that's why we'll be talking about burnout. And simply put, burnout is really that burning out, because of all the heat that we are experiencing as we continue to care for other people. And as much as if you look at the psychiatry textbooks and you look at what we call the diagnostic statistic manual, burnout is not yet recognized as a disorder on its own. The truth is, it is very common, and unfortunately, it affects many people. And though not recognized as a disorder, as it were, it is not well when you're burnt out, and chances are, if nothing is done about it, you likely would die, if not physically, emotionally. And we do not want to have people who are walking dead. And how does it look like then? And we say it's someone who is totally burnt out, emotionally, physically, mentally, and they are done. And I'm sure you have seen people who, even if vocabulary wise, they are not saying I'm done, they really are done. And this you can see from how they are behaving. And you get to a point where there's so much work to be done that you're no longer able to perform, and you feel like you're not real. Sometimes people even experience what we call the realization. You feel like this is not Edith sitting here this evening sharing about burnout. I could be someone else. Or sometimes you feel like it's not real that today is 13th December. Those are signs of complete exhaustion. And the other thing that one experiences when they are burnt out, they feel distant. They don't identify with their job, even if they are at the workplace, even if they showed up. They woke up early in the morning, went there, but really they're just moving like a robot. And someone can feel extreme negativism, and they did feel terrible about their job. They hate the work that they do every day, and they don't care whether it ends or not. And what happens when you feel like this then? Because you are not invested emotionally or physically, you have nothing else to give, then what happens is you're no longer as productive as you should be, and you're not accomplishing much. And there's always these complaints from people you're working with, from your boss. You're always getting negative report. And at that point, we see people trying to cope very negatively, not realizing that it's because they were burnt out in the first place, and that is why their boss is very unhappy, and now they blame the boss, and then they start coping negatively, as we'll see later. So simply put, it's just continuous occupational stress. There are many other types of stresses, but specifically today we are talking about stress that comes from a working environment. And I want to believe, we call ourselves healthcare workers, we believe that all of us have been working, whether privately, publicly. It's that stress, not associated with your wife or your children or your farm, that's not producing as much as it should, but that's resulting from the job that you go to every day. And closely related, just so that we don't get confused, is something called compassion fatigue. So burnout, there's a lot to be done, and you feel like you are no longer able to accomplish as much, compared to compassion fatigue, which results from just listening and seeing a lot of distress among patients, and you feel helpless and powerless, especially, for example, if you're working in a place where you're not able to help patients, or patients come in very like end stage cancer, and all you do after some point is just certified dead. You put someone on medication, but you know it's ending, that helplessness. So the work may not be as much in burnout. There's a lot that's being done. In compassion fatigue, there's a lot of pain that you're experiencing, which differentiates it from burnout. And another thing that's very closely related is moral injury. And moral injury, especially in settings like in Kenya, would occur, for example, because while you have gone to school, you've studied, you've even gone and mastered the art of saving patients. Unfortunately, every day you are not able to save those patients. Why? There's not enough medication, for example. There are not enough equipment. So you know what you should do. You know the medication you should give. You know the first line until fourth line, but unfortunately you have to give something that's probably, it's like giving water for injection to a patient who is dying, who needed an antibiotic, but you're giving them to make them feel like they have been given something, just because you do not have, and you cannot just sit and do nothing. So you feel like you've been betrayed by who? By the government of the day for not providing the facilities required, or by your med soup. Maybe they were able to procure a drug and they were not able to. So there is that act of omission or commission that make you feel, although you should have done, although you should have given even better care, you are not facilitated. And I want to believe that this is very common. However, this is probably a discussion for another day. Today we are talking about being overwhelmed because there's so much to be done. And why do we care? Why are we even talking about it this evening? Is it even common now that we say it's not even a disorder? But look, at what has been done. Different studies have been done in the country and outside the country. And the truth is, many of us sitting here are likely highly burnt out, if not burnt out totally already. If you look at this, the people who seem to have been doing better is probably people in the rural Western Kenya. And then these were probably people in lower hospitals where there was not as much stress, and they found 20%. But look at hospitals that there's a lot of work. Pumwani, for example, where a number of us probably delivered or we were born there. And you know what happens if you've been there. There's delivery, probably many deliveries every few seconds. And there's a lot of work. And unfortunately, if you find where there's a lot of work, the outcomes, many are good, but there's a probability that they are likely to be also some not very good outcomes. And if you don't have equipment and facilities, there's not a lot of pressure from everyone, from patients, from the relatives, from the people who are in charge. Look at Kenyatta National Hospital, again, our referral hospital, 95%, almost 100%, these ones are doing very badly. I hope things have improved since 2014. And this is true of many of us, that many of us, at least if you are to screen us for burnout, even if the severity differs, we really have been affected. So probably Kenyatta National Hospital represents the very, very high pressure areas where many people come very sick, and the outcomes sometimes are not very good. And there's a lot of expectations. If you remember what happened with this unfortunate young boy who unfortunately passed on, and there's a lot of blame, and no one looks at what could have happened, what could have gone wrong. Healthcare worker is always at the center. Even when the systems have failed, the healthcare worker is always at the center of things that go wrong. Unfortunately, we don't receive as many rewards, but there's a lot of pressure from everyone. So see, we are highly burnt out if these figures and facts are anything to go by. And one of the important messages we need to keep reminding us is very few people wake up and collapse and die. Many people will have done this very, very slowly. The problem is because we don't recognize it ourselves, our colleagues never recognize it. And I like this song by Casting Crown. As many of you would guess, it's a Christian song, but it's very nice because it says, people don't crumble in a day, nations don't crumble in a day. It's a slow fade where black and white, but black becomes gray slowly. Before you know, this person who was doing very well, highly motivated, went and even did that subspecialty and was very excited about emergency medicine. Then they show up in one of these hospitals that is high pressure, and suddenly they're no longer excited about that course, and suddenly things start changing. But unfortunately, both themselves and the people around them don't recognize until, unfortunately, it's too late, until someone has taken so much alcohol, their eyes are yellow from liver failure, or until they are being given a shock cause letter because they have been absent for so long, or until they have they have severely gone depressed and they almost have bed sores for not leaving the bed. Unfortunately, in this is because we have not been taught to recognize when things are going wrong amongst us, in ourselves, and amongst our colleagues. So let's hopefully encourage ourselves never to get, so we will burn a little because we are human and we are matter. We have an elastic limit. We don't have endless energy when we are exposed to all these things. But what we want to emphasize this evening is that continuously and very intentionally, we must notice when we begin to burn out. We must notice when people begin to burn out. And that's the whole point of the discussion this evening. And this is the truth. All of us need some degree of pressure. Actually, if you are not used, I remember when we learned, sometimes when you're in one field, you almost forget things. But there will be that concept of use and disuse, that if a certain muscle was not used, for example, it will atrophy. I hope that is correct for those who are continuing. And now me, I'm so used to schizophrenia, I may have forgotten. But if even a muscle, if it's not well used, it gets, because of disuse, it atrophies. So again, too little work, boredom is not good for anyone. You actually get bored and you start engaging in other things that may not be very productive. So we all need, for us to be optimal, we all need some degree of pressure. However, we also cannot take too much. No one has endless energy, endless strength. We just need enough And the problem is sometimes we don't realize that we have been taking on too much until we've actually broken. So we need to constantly remind ourselves we need work, we need pressure. And what happens is when you have a bit of pressure, you become creative, you adapt, you generate ways of being more effective without using so much energy, but only to a certain extent. And that is when you begin to burn out. And one wonders, what are these factors that are associated with burnout then among healthcare workers? Why would 95% of healthcare workers in KNH, for example, have some degree of burnout? And I want to propose to us that it's twofold. They are both systemic and individual factors that are contributing to this burning out that we are seeing. And maybe to start with systemic factors, mainly because we are probably not in charge and because we want to blame someone. And this is the truth. There's chronic underinvestment in healthcare, which has resulted in a lot of shortages for healthcare workers. I was just trying to look at some figures. I know this is not updated because this was published in 2017, but assuming that there has been some improvement, maybe not much, but the training need assessment that was done for healthcare workers in the Republic of Kenya in 2016 revealed that we probably had a quarter of what we needed. Look, we only had about 31,112. I know there are probably senior people here who know the real figures today, and we needed 138, 266 healthcare workers. And I believe that this is still true, although some facilities may have improved. This is still true of many, especially county hospitals, sub-county hospitals. So who is doing the work of the other three people who are missing? It is us, and we are continuing to stretch ourselves. We are continuing to go on. And I have heard people saying, I cannot go on leave because I'm the only medical officer. I cannot go on leave because we are only 2 nurses in the department. And if we go, then the department will close at some point. And I don't want to be an insider. I feel like you should go and let it close and let there be a crisis. But unfortunately, because we were taught to care and we were taught to make sure that things are working, we have continued to cover up for these shortages. And what drives me a bit angry is because the truth is the government is not totally incapable, especially if you look at what we do with our many other things we do with our monies that probably would be better placed if we would be better placed if it was invested in healthcare. So shortages, then of course sometimes the management, and I know some of us are management, are not very supportive of people, and we've had healthcare workers complaining of bullying, and you've had people being given show cause letters or being moved right, left, and center. I think it's slightly better now, maybe when the account is, because you can't be moved too far, but we still know that people can be moved from maybe a county referral hospital to a lesser hospital. There's all that, and I hope that as we go along, we'll also learn to be supporters of each other, and as opposed to the people who are killing each other. Poor infrastructure, and I know our hospitals, some of us are very dedicated and we are doing a good job. Although we are being blamed, really we are not to blame. We know that some hospitals lack, you have gone to school, you've trained, you know what to do, but you don't have a theater, or you don't have the basic equipment for you to support people, and all these things contribute to challenges. Supplies, of course, I know most of the time the out of stock is not a new statement for many of us. So lack of supplies, including medication, has contributed to people feeling extremely frustrated and working extra hard to cover up for those inadequacies. So systemic factors, and we are hoping that too can be addressed. And so what happens when you work in such an environment with all those with a not very well supported system is that you feel like you have little or no control over what you do. So you are well trained, but you don't feel like you have what it takes. And you feel like other people are in charge, and yet the buck stops with you, unfortunately. Then of course, lack of recognition. I don't know how many facilities actually wake up and say we want to award the best nurse, the best clinical officer, the best doctor, and you keep working, but you're never recognized. And unfortunately, we've even seen that some people are recognized, yet some people worked harder just because maybe they knew people. So there are all these things. And then there's a very demanding expectations. You have so many responsibilities at the workplace. And sometimes even your job descriptions are not clear. You're meant to be a manager, you're meant to be a clinician, you're meant to be in charge of so many other committees. And all these things you're expected to do very well in all of them. Of course, sometimes the work is monotonous and you wish you could prescribe second line, third line, you only have amoxicillin, whatever infection someone has, the only drug you have is amoxicillin and flagyl. All those, I hope flagyl it's still there. And so those things, and you feel like it's unchallenging, and you wonder, so why am I here? Why did I have to read books late in the night for it to be this way? And of course, not being able to see results of your work. You are always referring because you can't manage patients adequately. So systemic factors, and I'm hoping that even as we sit here, because some of us who are in charge or will be in charge, will be able to address those. But then also there are individual factors. And why do we burn out as people? If supposing there was an ideal government with ideal resources, do we have a role? And I want to say yes, we all have a role. And one of the things that is true of many of us is because especially we tend to be very respected, whether it's a nurse, a clinical officer, or a doctor, we are very highly respected people because of just being healthcare workers. Sisi ni madaktari, and therefore we are in charge of Nyumba Kumi initiatives. We are selected into boards of schools. We are chairing many committees, even in the neighborhood. And we just simply are too many things and for too many people. The other thing is that because especially if you work in healthcare, you are likely to have a little salary that is better than a number of people. Then what happens is that you are also the one, whether it's a harambe, the church is being done at home or the school, you are invited to be the guest of honor, too many things. And unfortunately, many of us have not learned that no is a complete answer. So we keep taking and taking and taking, not realizing that it is taking us closer and closer to our breaking point. And the other thing that happens a lot of times because of our work, our shifts, and the fact that sometimes we behave like we are very close to God. Of course, we should be close to God as Christians, but some of us, we because of the pedestal that being a healthcare worker, you are very important. You're the only one of the few people who can tell us very serious person to undress, and they undress, and you are allowed to get into people's space. You can ask someone whether they are married and how many children they have without feeling guilty. Those are very personal things. Because of that position, then we feel very important, and sometimes that alienates us from other people. So we have no supportive relationships because we have been consumed by our power and quote unquote our importance. And so we lack relationships, and when things go south, we have nowhere to fall back on. And because of all these things, and of course, we also know about locums, and locums affects doctors, nurses, clinical officers, many people, including public health officers. We have during the day, we are in one hospital, the next time we are in the next one. It's okay. You see, there isn't enough money. But again, sometimes we are overdoing it. So there's no work-life balance, and you're always struggling. And these are the individual factors that are contributing to us getting burnt out. And of course, there are some other inherent things other than what we have taken along the way, like things like personality. It is believed that people who become healthcare workers are perfectionists, people who just want to help, very caring people. And because you want patients and the outcomes to be very good, then these tendencies make us not delegate as much. And because also of experiencing this pain and the things we see in our service, then sometimes you can develop a very pessimistic view of the world. Like just feel like people are always dying. There's always so much pain and suffering. For many of us, including myself, the entry to the hospital, I have two entries to the hospital. And I'm either going through the mortuary and finding people who are mourning. And if I use another entrance, then I'm going through the oncology center where there are so many people who are struggling. And it can change the way you view things, especially if even earlier you had already begun thinking that the world is a very bad place. And of course, we have believed, a lot of us, to be type A personality, go-getters, people who want things to be done and done right now, not tomorrow, not a bit later. And those things are actually stressful, and they lead us to get burnt out. So what is the consequence of this burnout that we're talking about? And it's, again, we've talked about system factors, we talked about individual factors. And because we said it's occupational, it has everything to do with your workplace, then two aspects suffer when you get burned out. Of course, at the workplace, this is a doctor or a nurse who is totally detached from what they are doing. So they are not as productive, and they don't care whether patients get better or not. They are likely to get, if they have poor concentration, they are likely to make errors. And you all know that errors in healthcare are very costly. And of course, there can be a lot of job losses. And if you are an employer, for example, high turnovers, and you have trained people, but because they are burnt out, they go, and you have to keep hiring new people. So it's costly. But of course, for an individual, it's also very costly, both mentally and physically. And someone can develop mental illness like depression or try to cope by using substances. And we have seen in the recent past healthcare providers dying despite knowing that alcohol kills and burns the liver. We are drinking, and some of us, it's because we are burnt out and we don't know how else to cope, because anyway we killed our social life, and we don't have good support system and all these things that we've talked about earlier. So it's costly. And the question then one asks is, then how can we know whether I as a person am affected, or how would I know if my colleague is affected? And again, you don't need to go to a psychiatric class to know these things. Sometimes when we talk simply about changes that persist and are affecting productivity. And these are the people who have frequent headaches, especially tension type headaches, no matter what they take, it doesn't get better, then it's possible that they can even get now addicted to. What I've seen is that now they get addicted to painkillers, and before you know, then they're even being treated for addiction to those painkillers because of these headaches that never go. Chronic fatigue, you sleep 10 hours and you wake up still feeling very tired and you wish to continue. People who have irritable bowel-like symptoms, and it never gets better. Of course, we're not saying everyone who has GI symptoms has burnout, but we are saying these are some of the things that could be experienced. Mood swings, and one day very excited, another day bottom of the cliff kind of feeling. They would be forgetful, they have no energy, and people can even start neglecting themselves. They have no time and they don't care, especially when you stop now, you're living burnout was now sickness. Then you see people are not, they don't care whether their hair is done or their shoes are polished and all that. Then of course at work, you'll notice absenteeism, you notice someone who is not able to complete tasks. People can make decisions, a very, very well-trained surgeon, but they can't determine, they decide whether to take this patient in or do conservative management just because they are stretched towards breaking point. Absent-mindedness, restlessness, you're in a meeting, they keep walking in and out and they look like they're staring into space. And of course, changes in attitude most of the time, which is negative because they no longer are able to keep up. And how would you diagnose burnout, for example? And of course, for you, if you saw a psychologist or a psychiatrist, they are able to take you through a process. And we have said you don't need to be a psychiatrist. You can notice those symptoms we talk about. But if you want to be objective, then there are tools that, like the Maslach burnout inventory, it has been used widely in Kenya, and you can look at it and see some of the very simple questions in that burnout tool. But there are so many others that we wouldn't even go into details of. But then, so what? You know, it's not enough to say we are burnt out. It's bad to just say, oh, people, 95% of the people in KNH are burnt out. Or MTRH, maybe our MTRH is 100% or maybe better. We don't know because we haven't collected data. We hope one of these findings will be doing national surveys. Like I find that the UK and the US are really interested in, and then they have national representative data. We hope we can get there very soon. And so for me, the most important question is not that we are burnt out. The most question is, what can we do then moving forward? Because we may not go back, but it's something we can do. And for those who are not affected, it's something we can do. And again, we said they are both systemic and individual reasons for having burnout. So then even the solutions must be twofold. And especially because we said it's us, we are also part of the managers. So there must be systemic solutions. And the truth is, if you're going to address shortages, if you're going to address the poor infrastructure, if you're going to address the limited supplies that are driving us to burnout, then unfortunately, government has no option but to invest in healthcare, and we have to work together. I know there's all this drama of sibling rivalry, but we have to join hands as healthcare workers, ensure that continuously we are working towards the recommended budget investment. Is it 15%? I believe Kikondu is here, probably knows better. I don't know whether we are at 3-point-something% of our budget goes to healthcare, then something like that, and we need to get to 15%. And I really hope that we can work together to do that. Na hiyo hatutaendelea sana. So just in case we are saying we are inciting people. But one other important point at the institution, at the systemic level, is to ensure that our workplaces, whatever they be, have policies on mental health. We know we have policies on HIV, we have policies on gender-based violence, and we want to make sure that we have policies on mental health. And simply put, and I refer to the World Health Organization policy on mental health at the workplace, and there's a lot of information available, is that you must be at the workplace, provide mechanisms for prevention, supporting people, allowing people to go to work as much as possible within hours they can manage. And then early detection, when you notice change, systems, the facilities, the counties, even at the national level, there must be ways of detecting that this person's attitude is changing. This person is suddenly becoming absent. There is likely to be something wrong. And then, unfortunately, some of us will be affected, and other than burnout, could even go to other mental health issues, depression, substance use. And there must be mechanisms of support to be able to approach someone and say, we noticed and we believe and there's hope and we want to link you to care and some form of rehabilitation. And after rehabilitation, not stigmatizing, reintegrating these people, supporting them. And that is likely to be done well if you have the employee assistance policies and employee assistance programs in place. And if you don't have one, please come to MTRH. We are happy for benchmarks so that we can share with you. I don't think we are doing perfectly, but at least it's a starting point, and we encourage that, especially for those in leadership, these policies need to be in place. What about the individual? Because we say it's systemic and individual. And at the individual level, and again, we want to say that there's something you can do. We also don't want to have a serikali idea mentality and say, it's the government that didn't employ people. It's the government that didn't provide infrastructure. So I'm helpless and hopeless. We are saying as healthcare workers is something we can continuously do for ourselves. And that is creating awareness and supporting each other to continue as much as possible, reducing the stress levels at our workplaces, because that is draining, and to improve our own ability to recharge. There's no vehicle that can continue going, however good. I don't know what the best vehicles there are, because I'm not a vehicle person. I just need something that moves me from point A to B, but there are people here who are very good. But whatever the vehicle it is, it can't keep going nonstop without going for, even the vehicles go for service. And if it doesn't go for service, you even mark after every 5,000 kilometers, you need to refill, to change the oil. After traveling for how long, you need to check the tire pressure. That happens very well for vehicles, but what about us? We want to keep going, and imagine that will be fine. And unfortunately, we collapse. The engine fails, and that's when we know that, we should have changed oil, we should have checked all these things. We must build continuously our ability to recharge, our ability to correct early on without waiting for things to break down. So we need to be recognized when things are changing in us, when things are changing in other people. We need to reverse any damage that may have been done by seeking professional help and doing other things, and we must continuously build resilience, especially for our young professionals who are joining. And without emphasizing this, I know there has been discussion about life-work balance, life-work integration. This is it. We are stretched. We just say that we are burning out because we are stretched. And this is the truth. We can also not just be healthcare workers and not parents and not neighbors. All these things have to happen. And unfortunately, they happen at the same time, because life is not too long that now you can one day just be a healthcare provider, do it very well, and come back to be a parent. You also can't continue being a parent for so long, and then work will be waiting. All these things might happen at the same time. But then how do we do it? And again, maybe this looks like it should be a whole topic on its own. But yes, I think it's good to remember there's nothing like perfect life-work balance or integration, if you like. And that at times you will work a little more, at times you'll spend a little more with the family. But there must be continuous effort to do a good job, because you need it for salary and to serve the people you're serving, but you also must have continuous effort to support your family and participate in other social activities, including church, school, sports. And we don't say you should judge yourself based on today. How did I do? Today, I'm likely doing very badly because I'm sitting here at 7:30 instead of sitting with my children. But then what do I do tomorrow? So it's not just a day. So that I say, I will not present in this ME because it takes my family time. I think it's saying, because today I spend so much time and I'm here sitting instead of playing with my children, and tomorrow I'll cover up. So it's you don't look at it as a day, but you can look at a week or a month and keep checking how much time are you spending outside your workplace. Of course, being flexible is also very important, so that you don't only work only like I can only leave work at 5, and if there's someone needs me, I can't extend a bit. Sometimes leave early, sometimes you can stretch yourself if need be, but make sure you are continuously adapting to make sure not your job, not your family or other social activities suffer. The other thing is because there's so much to be done. I don't know whether people in research are the worst people, but there's always so much. There's a paper to be published, there's a report to be done, there's always something, and then the next grant is being applied for. That's my life. And sometimes you wonder, when does it end? And I have decided it never ends. You actually have to decide what needs to be done now and what can wait. And it's okay for something to wait for next year. It's okay you don't have to publish all papers, you don't have to do all the degrees right now, you can just decide what you want to do right now. Prioritize, say what is important and why is it important right now, but what must wait. And remember not to sacrifice your family while at it, because unfortunately children grow and parents grow older, and unfortunately, because we are not here forever, those people can't always wait. So make sure you are including them, because they are the glass balls that don't make a lot of noise, but unfortunately if they drop, they break and the damage is permanent. Boundaries and work hours, very, very important. The other day I went on leave and I was very happy for the first time to have used away on leave. And then some people were disappointed because they were getting all this bouncing, but I was so happy when some people responded and said, thank you, we have noted, we will reach out to that person you have mentioned. I have never felt that good. Actually, I decided now, Muzungu style, every time I'm going on leave, I will have that thing, because it actually saves you a lot of energy trying to answer emails when you're on leave or have traveled. And it's okay, you're not showing off, you're just saying, please, I'm not going to answer your email this weekend, I'm away. So let's set boundaries, and let's say when we can work, when we can't work. Again, remaining flexible, especially when there are deadlines, but making sure we don't have deadlines every day. Good time management, very, very important for us, especially in this day. How much time, honestly, have you spent today on social media? Actually, the worst mistake I've realized is to start looking at WhatsApp or Facebook early in the morning. 2 hours pass and you have no idea what happens, because there's always gossip and a sweet story, and there's so much happening and it never ends. And we want to check once again, because this is contributing. You waste 3 hours on social media, gaining very little, and now you have to catch up. And we must teach ourselves to prioritize and say social media, you will get the news later in the evening. You don't have to start with it in the morning, especially if you have challenges of addiction, like I think I have potential for that, so I try to minimize. And what we say, if truly your work environment is toxic and it's not working and it's killing you, you had rather be alive jobless and looking for an alternative than dead. So please make sure that if you can't change things in your workplace, and I'm not saying you must quit medicine. For example, if you are trained in healthcare provision, but you can, if you don't like the accident and emergency, you can teach, but still in medicine, or you can do research, or you can do other things. So I'm not saying totally quit and start again. Our life is not too long for you to keep changing. And I think so that contributes to most of what I wanted to say. These are things I have repeated in the past, but part of managing burnout, self-care, self-care, self-care. You must do everything that you need to make sure the engine the oil is changed, and the thing we are talking about, because you just can't keep going. Eating well, sleep well, take rest. It's okay to take a rest and do nothing. And I think because of our nature type A, we said, me and a friend of mine have said that we need work to live, because we are terrible workaholics, and we have to keep reminding ourselves that this is a time to say no and just disappear. Please take breaks as much as you can. And if you can disappear into the bush and do a lot of nothing, please do. But if you must, then if you can't afford that, because also it's sometimes expensive, you can also disappear in your house and do nothing and just sit and read a book or an old newspaper if that's what you have. But just stop and say, I have had enough. Taking vacations if you can go far, please do. If you can't, it's okay. Social support, we said we alienate ourselves because of the importance our job puts on us, and we want to remind ourselves, including the boy child here, that each one of us needs someone to lean on. You need to tell someone, I feel terrible. And I want to challenge all of us that if you don't have a support system, it's time that you establish a support system. Someone who is not going to air your story, but is going to tell you, I got your back. And you know what, dude, you can make it. And it's okay to feel how you feel, not man up, because we don't want people just to be told to man up all the time, because then that's where they're crashing in. People will give you energy and keep pushing you. Problem solving, even just this time management, even all these things that we have to work on as part of problems. So we need to improve our skills on problem solving and ask ourselves, what do we do if the problem is that I can't manage time because there are so many expectations? How did I get here? And what are the options? Are there things I need to drop? And you have to learn how to do what you call a root cause analysis. Go to the bottom and find out, why are you in this mess? Why is it that you haven't seen your children the last 2 weeks? Because you've just been up in meetings, at work, and all these things, and it's killing you. How is it that you are not able to check, to even your checks are expiring? I've seen even healthcare providers, checks they are given, they expire because they have no time to take them to the bank. It's a problem also. Why should you work so hard? And that the check expires on your desk because you have no time to go and cash it. So whatever it is that your problem is, problem solving is very important, because you said you're burning out because there are all these challenges. If you look at them as problem, and you need to keep asking yourself, what options do I have? What can I do right now to be a better person? So very, very important. Problem solving, cheering yourself up. In psychotherapy, they'll call it behavior activation, but I call it cheering yourself up. Remember, at the end of the day, you need to be your own cheerleader, to get out of that bed when feeling totally exhausted, energyless, and say, you know what? I have something I can do. It may not be a big thing, but it might just be watching football. After all, I haven't even watched this World Cup. I've been so burnt out and I've just kept going. Then responsibilities, other than watching World Cup, if you haven't watched, please do. It's been very interesting. And we all are hoping that somehow an African team win, hopefully. And maybe you're so burnt out, you will not even check it out. It's still fun as it was 4 years ago. But of course, we don't say just watch football or listen to music. We say also do activities, garden, learn a new cooking style or something, things that also build you. And notice when you feel better. Positive thinking, you think, you behave. You need to recognize automatic negative thoughts that tell you you're useless, you're a failure, you're never good enough. You're feeling like that because you're burnt out. But the truth is, you're just challenged because you've taken so much. That's what we call evidence-based thinking. And what you need to do is not to die, but to manage these stressors, and there's hope. So you need to be able to replace all those negative thoughts with healthier thinking. And as we close, we want to remind us, we are human, we are affected. And we are affected maybe much more than people out there, the ones we are taught to take care of. And we need to normalize taking care. We are taught to help. And the truth is, we cannot continue to put anyone's oxygen mask on other people when ourselves we are crashing. For us to be able to give help, we must be healthy. So let's normalize taking care. Talk to a psychologist, talk to a psychiatrist, talk to someone so that you keep going. And as I finish, I really like this song because it reminds me that truly deep inside this warrior, there's a child inside. And if you haven't listened to it, I would encourage that you read. And the truth is, you've been winning. You've saved many people, you've done many things, and you've achieved so much. You've bought so much land, you built things, or whatever it is that you have achieved. But the truth is, even with all those, it's possible that when the world thinks you're a hero, you could be thinking that you are useless because you've been burned out. And it's good to remember that even winners get wounded in a fight, and many of us have been wounded. And though outside we love to portray ourselves as strong and looking great, and people say how much energy we have, the truth is many of us are continuing to cry, and we hide our tears, and we put makeup and look strong. And all of us need a place we can go running to. That is a home when we fall down, because sometimes we will. And all of us need a social support system, people who can pick you up when you are broken. And it's okay to cry just for a while. It's okay not to be okay and to say, I'm defeated and I need someone to help, because even soldiers need a quiet place to rest. Thank you very much. Back to you, Melanie.
Wow. Thank you very much. That was quite an insightful presentation this evening. Very, very amped, and just the right time that I think we all needed to hear this. Very key things that I've picked from your presentation. 4 amongst them: 1, prevention. 2, early detection. So as colleagues all healthcare workers, irrespective of their cadres, out there looking out for each other, are very important. Support, both are looking for social support at work and also at home or even outside the work environment. And finally, when you're diagnosed, let's go through the treatment process. Should you have a mental health issue, go through the rehabilitation, and then you can be able to get back to work. Next, I'm going to go through the Q&A session. I'll check which sessions we'll have on. I'll see which questions are available on, and I can see we have 3 people who raised up their hands. We can start with Millicent Korir. I can see your hand up, then we can have Lawrence next. Millicent, you can ask your question.
Melody, I think if she's not part of the panel, she may need to be invited, and that may take a minute, unless Peter can do that quickly.
Okay, meanwhile, let me just read. I can see a couple of questions on the Q&A. I can see one talking about toxic work environment. This is mostly created by the bosses or senior colleagues. Maybe you can just mention about that. There's also a different question on what's the difference between burnout and depression. And finally, how do you protect healthcare workers from stigma associated with seeking mental health treatment in the same facility? Maybe you can tackle those 3 and then we can pick the rest.
Thank you very much for your question, Collins. How do you deal with the toxic work environment? And one, in dealing with stress, I think there are things there are a few A's we talk about. We say sometimes you may need to accept. And in a toxic work environment, you may need to accept that you're not in charge of everything, unfortunately. And however much you want to change the environment, maybe you may not, especially because you may not be very senior. And if you make noise, you can even lose your job. So it's good to know that there are some things you may need to accept. That one, your boss is toxic, the environment is toxic. And then the only thing that you can change is your attitude towards it. And you can say, I am staying, especially if you don't have an option. Remember one thing we say, that really, let's always remember that we can change. We must not die. It's not true that you must stay. But if you must stay, then sometimes it's the attitude and looking at them positive aspects of it, other than the fact that your boss is mean or the work is not very nice or colleagues are not great. Are there positive things? Is there anything you appreciate? And is there anything that you will keep you there at that workplace, maybe to keep earning a salary as you keep improving yourself? But could there also be things that you're doing that cause people to have like negative reactions towards you that you can change? Remembering that I can change me, I can change how I view things, but I may not change many things in the environment. Then the other thing is avoid. Are there things you can avoid? Maybe you can avoid making careless mistakes that cause maybe your boss to be very mean on the work, look very difficult. Are there things, and you need to have a very good analysis of the situation. So you ask what aspects, because there are some things you need to accept. There are some things you need to avoid completely. And there are some other things that you adapt. So if it's, for example, the reason why it's toxic is because you are deficient of a skill, for example, and that is why someone keeps talking down on you or at you. Can you then gain the skill so that you're able to fit in? So always asking yourself, what options do you have? But of course, you had rather live than die in that environment. But as much as possible, it's good to try and ask yourself, what do you need to accept? What do you need to avoid? And how can you adapt so that you fit into that environment? That's what I'd say about that. Then there was another question of stigma associated with seeking mental health care. And yes, it's very, very common. Many people tell me, I'll send your mother, but don't tell them who you are. But I have made it practice, whether it's a child or anyone I see, I tell them, mimi naitwa Hoba wa mentor. I am not a surgeon. I'm not an obstetrician. And from the word go, if we are going to move on, you must accept that you're here, not seeing any other person, but seeing a psychiatrist. Why is it so? Because then what are we treating? You will be very disappointed because I have nothing to cut. I'll just keep talking to you and encouraging you. So, and it has to start with us, even ourselves. Are we comfortable seeing a psychiatrist? There's a lot of stigma, but we want to remind ourselves that there are diseases that have different levels of distress, including things like cervical cancer. It causes a smell, it causes a lot of, it's very uncomfortable just sitting and being examined. And yet we've embraced that and say that is okay. We need to say, as long as someone has a brain, then the brain can malfunction and someone can talk to themselves or undress in public or take too much alcohol. So it has to start with us healthcare workers. And it includes even the language you use. The patient comes and say, huyu ni psych, huyu ni wa kinakopa, huyu ni wa madhari. Even those things, we must catch ourselves continuously. So that it starts with us and reminding ourselves, if the cervix can be affected, if the breast can be affected, if the leg can be affected, the brain can be affected. So it's a lot of awareness, and it starts with us normalizing seeking care. And also not even for those in management, where you place the ward, how we talk to our staff about seeking mental health care, very, very important. And that's why we are saying even mental health, like healthcare facilities need to have, the same way you have a TB clinic, you need to have a mental health clinic for staff. We've tried to do that in MKRH, and there's some very good reception, including people referring themselves. And also those who are affected, speaking out, saying, I'm a nurse, I'm a doctor, but I'm comfortable seeking mental health care. There was another one. What is the difference between burnout and depression? So depression is a chronic and recurring illness with a very clear set of symptoms: low mood, loss of interest, and we say, if you like the DSM-5 criteria, you have to have many other symptoms: poor sleep, lack of appetite, and all that. Very clear disorder, very clear symptoms. Now, burnout can be a precursor for depression. But burnout is just when you feel exhausted because of your work. So you may not be feeling sad, you may not be doing all this, you may not have low appetite, and your sleep could be affected, but not significantly, but you're tired. You no longer want to work, and you don't have energy to continue. Burnout can predispose one to depression. I think I've answered.
Thank you, Dr. Koba. Yes, you've answered all the previous questions. Let me see if Millicent is now able to speak. Millicent, are you able to unmute yourself? You can attempt to unmute yourself and speak. Okay, Millicent is, well, she's trying to do that. Lawrence Njoroge, are you able to unmute yourself? Okay, Dr. Koba, I think I'll proceed to read the other questions. I cannot hear. There's a question by Zipporah Maderi, who asks, how can mental health professionals do a debriefing, or how can they take care of their mental health? There's also another question by an anonymous attendee who asks about task shifting, like seniors skiving work, which can burden the junior colleagues. So this one, I'll take it to cut across all the cadres, all the, let's say, the junior nurses, as well as the junior clinical officers or psychologists. Is it a significant contributor to burnout?
So I want to start with the last one. Of course, we say shortages are part of the reasons why people burn out. And if you don't show up at work and there's already a shortage, then it means that those who are left behind have to work a little more. And the truth is, you might have been more skilled, so they're even trying to make do with what they know. So it's a significant challenge, and I hope going forward, especially for the seniors who are here, we can encourage ourselves to work, because if you don't do the work that you're trained to do, then what was the point? And also, in my view, I see it as stealing from the government, and it's also unfair that you're not available, because the person who comes to seek care expected that they'll find help where you are. So I think that it's very important that we make sure we are supporting each other by being available and doing the best we can with the little resources we have. Because sometimes we are saying it's the government and it's ourselves, because we are running away from work when we should be at work. I think there was a question that may have disappeared. How can mental health professionals do debriefing? So psychologists are doing a very good job And I think we need to borrow from them. And they do what we call supervision, where they sit with a psychologist, a different psychologist who is not involved, and they are able to like share what they have gone through and what it meant for them. But that's not part of the training. I hope in future it can be part of what we do every day. But between now and the time supervision can be normalized, you in your institution, in your department, are you able to sit together and say, well, that patient who passed on in our hands, it was painful. And these are the things we are learning, and this is what we can do differently in future. And check, because we are affected differently. For some people, that person reminds them of a brother or someone close to them, or a death that they witnessed, and they are affected differently. So don't just move on and assume everyone is okay. And especially for team leaders, providing opportunity for people to talk about what they've just gone through, especially when it's near misses. You see things like maternal mortality are very painful. And then sometimes people just keep moving on, next. And even when you go through a mortality meeting, the discussion is just to make sure that things are covered up, or blame the juniors. But I think providing that environment and saying, now that is gone, what can we do differently so that we help each other, and checking those who are affected most. That's what I'd say. And then was there another question? I think those are the main questions you mentioned, but I had seen another one on the toxic environment, but now this is the employee being the one who is toxic. And I think the question is, why is this employee toxic? And what options do you have as a manager? I think the question is, again, it's just reverse in the sense that it's employee, but it is, does the employee have to stay? And what are the mechanisms that are put in place when someone is not respectful? And why exactly are they toxic? So that at the end of the day, we ask, are there things you need to accept? That's what they are. Are they so important that you can't let go? Are there things you need to avoid, like maybe bringing them down because they are the ones who maybe have a skill that you don't let go, but you're still talking down at them, and that's why they are mean, as it were. So ensuring that the A's that we talked about, accepting, avoiding, adapting, still applies whether it's employee or employer.
Thank you very much, Dr. Koba, for responding to all those questions. Very, very important points that you've brought in. I think this comes to the end of our webinar this evening. I would like to just inform everyone who is in attendance today that we'll be having a series of these webinars throughout the next 11 weeks, and it will be covering mental health issues relating to our work and among us all healthcare workers, and we look forward to interacting more. So towards the end of this, I will invite, yes?
Melanie, I noted there were some chats. I don't know whether you checked through, other than a Q&A, whether there are questions there. I think I had seen one.
Yes,
I
yes,
don't know
yes.
whether it's been.
Is there any particular you'd like to respond to or address directly?
No, I thought if you have looked at it, it's good. I just wanted to make sure that that was also addressed there.
Yes, I've seen a couple of comments about getting the presentations. This presentation and this webinar will be shared on our YouTube channel within the next 24 hours, maximum 48. So you'll be able to even listen again and share with you all the other colleagues who did not attend this evening. Thank you very much, everyone in attendance. At this point, I will invite our Secretary General for the Kenya Medical Association is in attendance, Dr. Diana Mari.
I think I want to appreciate the attendees. I also want to appreciate the panelists. And I just want to remind everyone, I like the statement that even soldiers need a place to rest. So as healthcare workers, let's always remember that when it gets to that point where you need a break, take it. When you need support, ask for it. And as for that, I want to wish everyone a good night, and I hope that you will be with us throughout the other webinars. Thank you.
Melanie, the only other thing that I've seen is whether there's help. I think the call center is we have had a call center in the past. I don't know whether you want to comment on that and how it's going on right now, but we've had a call center. But I also know for healthcare providers, Chiromolen has also been very supportive and providing just a toll-free line. But I also want to encourage that other than that, just seek help nearest you. Right now, COVID-19 was there was a positive aspect of COVID-19 for us mental health care providers. Very many psychologists were hired by the government in different hospitals. You'll be surprised. Someone said Trans Nzoia has like 5 psychologists. So it's not only in Nairobi. I am in a group called Mental Health and Psychosocial Support for all 47 counties, and no county is not represented. To mean that near you is actually help. Don't be afraid to seek help near you. And if you can't, like through KMA, through the different associations, we're also happy to link you with care. After COVID-19 happened, we've talked to people. We've actually had therapy on phone. It's not ideal, but we have started something and linking you to the nearest facility. We have more psychiatrists now training. So don't be afraid to reach out. We are happy to link you up with someone who can help you.
Thank you very much, Dr. Kopa, for those closing remarks, and Dr. Diana Mariam. I will close the webinar at this point. Goodbye, everybody. See you next week on Tuesday. Thank you.
Thank you. Bye-bye.